During this video, I'm going to talk about the detailed head to toe. This is going to be assessment. We're looking head to toe, trying to find anything that we've missed on this patient. We're going to be looking for DCAP BTLS, which stands for deformities, contusions, abrasions, punctures, burns, tenderness, laceration, and swelling. Starting at the head. You're going to put a gloved hand behind the patient's head, looking for any blood. Next, I'm looking behind each ear, looking for battle signs. I'm going to be looking at the eyes for raccoon eyes. I'm also looking at the eyes, the nose, and the mouth, looking for symmetry, looking for blood, looking for any secretions coming out of the mouth. I'm also going to look at either ear, looking for cerebral spinal fluid or C-spine fluid. At this point, I'm going to completely expose my patient. I'm looking at the neck for a stoma or for a medical alert tag. Next, I'm going to be feeling for the clavicle. It's the most commonly broken bone. I'm going to place both my hands on the patient's chest, feeling for equal chest rise and fall. I'm going to check the sternum to make sure that it's intact and in place. I'm going to feel along the ribs to make sure that they're all intact, or I'm not feeling any crepitus. Crepitus is when bones are moving against each other. Next, moving down to my abdominal quadrant, I'm going to assess all 4 abdominal quadrants. If they're experiencing any sort of pain in that quadrant, I'll start furthest away from that quadrant. Putting hand over hand, I'm going to palpate, which means touching each abdominal quadrant. Next, I'm moving down to the pelvis area. I'm going to expose my patient. Here I'm going to do the pelvic girdle. I'm going to squeeze and rock gently. I'm going to be checking for a priapism. I'm going to be looking for any incontinence. Now moving down to my lower extremities. I'm checking for any contralateral movement. Now I'm going to ask the patient if they could pull and push against my hand. Now I'm checking my next extremity, looking for contralateral movement. Once again, asking if they could pull and push against my hand. Next, I'm moving up to the extremities, looking for contralateral movement. Asking the patient, can they squeeze my hand? Moving on to the next extremity, looking for contralateral movement. Asking if the patient could squeeze my hand. Next, I'm going to sweep under the back and feel under the buttocks, checking for any blood in my hand. And that's the detailed head to toe. Thank you.